4 o'clock on Thursday, June 18th, which is also the birthday of my daughter Lila, who turns 10 today. So I'm going to do my best to get through this in an hour because she's expecting and waiting on me. Let's start the way we always start, by knowing that no matter how long it takes, that we're going to get through COVID-19 and we're going to get through it together. And we're going to address all the challenges that are in front of us. We're going to come out on the other side stronger, better, more compassionate people, better prepared for the future. We're going to take the lessons that we have learned, and we are going to make sure that we make the changes that are necessary so that the next time that we face a challenge, whether it's like this or like something else, that we are ready, that we can help everyone as quickly as possible, that we lose fewer lives in relation to any pandemic. Our goal is always, no matter what we're doing, it's got to be to improve, to do better, and to continue to serve our fellow human being and Kentuckian. One way that we can better help our fellow Kentuckians as we move forward is filling out our census. Incredibly important. I know we've been asking people to go online for multiple reasons, including previously to get an absentee ballot. But remember, this is absolutely critical moving forward. It's how we get funding in so many different parts of our safety net that has been so needed here in the last several months. If you haven't filled out your census, it's your obligation and duty as a citizen to do it. Please spend the 2 minutes to get it done. We're going to start with a COVID update today. We're then going to move into a couple of other topics. But first, while we have had more cases today than we had yesterday, it still remains in a manageable area. Today we are reporting 234 new cases of COVID-19, and our official state number is now 13,197 total cases since the start of this. We've got to make sure that we can keep our numbers of new cases in this type of range. And to give you an idea of how that compares to a couple other places that are struggling right now, Arizona is about 7 million people, maybe just a little bit more, compared to our 4.5 million people. They had 2,500 new cases on Wednesday, 2,300 on Tuesday. Think about that. You know, that's almost 25% of our cases, just in a couple of days. So let's remember, while these numbers are in an area where we still have reopening that is on track, where we still have the capacity in our healthcare systems to take care of people, that it's a very fragile place where we are. We need to continue to follow the healthy at work rules. We need to continue to wear masks, and those that aren't out there, and I know there's a number, we need you to reconsider. It's not a test of your manhood, whether you wear a mask or not. I think it's a test of your compassion, maybe even your faith, if you're willing to wear one of these to protect a fellow human being. Remember, we all have a duty to each other, even folks that we've never met. And every health official is saying wearing a mask can help protect them. Our 234 new cases today, 43 come from Jefferson County, 33 from Shelby County, 14 from Harrison, 13 from Fayette, 12 from Scott, 8 from Boone and Jackson, 7 from Kenton and Warren, 5 from Graves, 5 from Madison, 4 from Clay and Taylor, 3 from Davis, Franklin, McCracken, and Woodford, 2 from Bullitt, Callaway, Campbell, Clark, Fulton, Jessamine, Laurel, Marion, Spencer, Union, and Washington, and then 1 from Adair, Barron, Boyle, Bracken, Carroll, Casey, Edmondson, Fleming, Garrett, Green, Hardin, Hart, Henderson, Henry, Letcher, Lewis, Logan, Marshall, Mason, Mercer, Monroe, Montgomery, Muhlenberg, Nelson, Pike, Pulaski, Rockcastle, Simpson, Trigg, Whitley, and Wolf. And reason for reading these off each and every day is to remind us that it is everywhere. It's in every area of the state. Just because it seems like there's only been 10 cases in your county, we know there are more. And as we see, say today from Shelby, or what we saw from Warren, which continues, it can go from a few cases to a whole lot very quickly. So let's make sure that we are doing our best, knowing that when reopening, knowing that even though it's summer, that we still are living in the midst of a worldwide health pandemic. Our total number of tests thus far in Kentucky since the start, 336,267. That's up over 6,500 since yesterday. We continue to be on a good trajectory. However, the makeup has changed a little bit. I think we're getting more tests in from people who are having elective procedures in hospitals, and we're having fewer people sign up for some of the drive-through testing that's out there. We need people to do both. We can be safer. We can reopen more. We can later look at increasing capacities of different things. If we can keep our testing up, that includes our drive-through testing, we've got to know some of the asymptomatic rate out there, and we've got to be able to catch those cases. Our total number of people ever hospitalized, 2,482. Currently hospitalized, 400. Those are 400 people hospitalized for COVID. There are many other people hospitalized for different reasons out there, and we are watching carefully our bed capacity, and that bed capacity is number of free beds. Not just number of beds that don't have COVID patients in there, but number of free beds to make sure that if there's a spike, then we can make sure we can take care of everybody who needs it. Total number ever in the ICU, 975. Currently, 68. Again, these are just the COVID patients in the ICU, but it's remaining fairly low. Total number of recovered, again, I think this is really low. This is one of probably the least reported numbers we get from different groups, 3,506. Now today, we did sadly lose 3 additional Kentuckians, bringing our total death count due to COVID to 520 individuals. That's 520 individuals just since March. And it's 520 individuals whose families are reeling and need our help. They include a 79-year-old man from Perry, a 91-year-old woman from Jefferson, and an 87-year-old man from Logan. Let's make sure that we continue to show the compassion we have, light our homes and our businesses up green, ring those bells at 10 a.m. These are 3 families that need us. Now, our overall count of people we've lost did go down by 1 if you took yesterday's number and added our 3. That's because we continually do reviews, looking at all the medical evidence of those that are included passing away from COVID. The one removed was a 95-year-old woman from Grayson. It was determined through medical evidence that she had recovered. Even though that she had tested positive, she had recovered before her passing, and so she is no longer included in the list. That doesn't make her passing any easier for her family. Let's make sure that we remember her too. When we look at breakdown of race and ethnicity of overall cases, 73.53% white, 14.92% black, 6.22% multiracial, 4.65% Asian. Ethnicity, 82.79% non-Hispanic, 17.21% Hispanic. And we're seeing a lot of cases in our Hispanic communities across Kentucky. On deaths, where again we see disproportionality that we cannot ignore, we must address, and we must make sure never happens again. 79.67% white, 16.84% black, 1.85% multiracial, 1.64% Asian. Ethnicity on deaths, it's still about the same as it was yesterday, 96% non-Hispanic and 4% Hispanic. So we continue to look at long-term care facilities. We've had 25 new residents test positive, 7 new staff, and 2 additional deaths. Those are all in residents. 2 additional facilities have at least 1 COVID case. So let's remember throughout this weekend, even though we're allowed to get together with folks, which we weren't before, we have to be careful. We will have a release giving our numbers of cases and those that have passed Friday, Saturday, and Sunday of this week. We've been asked by the federal government to upload data for Sundays, so that means we'll have to bring in our people, get those numbers. We were trying to give them one day off, but we will put that out via release this Sunday. I know that's a change. All right, switching topics. Tomorrow is a special day in America's history. It's known as Juneteenth. Juneteenth is a day that is recognized when Major General Gordon Granger led Union soldiers into Galveston, Texas, to bring news that the Civil War had ended and to read General Order Number 3 that stated, in accordance with President Abraham Lincoln's Emancipation Proclamation, all enslaved people are free, and former masters and enslaved people have absolute equality of personal and property rights. I believe this is oftentimes known as the true end of slavery in the United States, the date that the very last part of our country had this order read. Sadly, it was several years after the Emancipation Proclamation itself. During these times when, again, we have heard voice and we have seen the frustration of hundreds of years of the ramifications of slavery, discrimination, of Jim Crow, of segregation, I think it's more and more important that we remind everybody of this dark chapter in our history and that its impacts continue to linger, and that we celebrate the dates that at least portions of it ended. So today, I'm going to sign a proclamation recognizing Juneteenth here in the Commonwealth. I believe it's the first time that it's been recognized. And my commitment is I'm going to ask the legislature to recognize it as a state holiday through legislation that would have to pass in the next General Assembly. But I think it's time. It's the right thing to do. And I'm going to do a ceremonial signing today. I'm going to ask my Executive Secretary of the Cabinet, Michael Brown, to read the proclamation, at which point I'll sign it, and we will officially recognize Juneteenth here in the Commonwealth.
Thank you, Governor, and thank you for giving me the opportunity and honor to read this to the public. Whereas, during the Civil War, over 200,000 African Americans fought bravely in the Union armed forces to secure their freedom from slavery and preserve this Union. And many sacrificed their lives for the ultimate freedom of their families. And whereas Juneteenth, National Freedom Day, celebrates the events of June 19, 1865, when Major General Gordon Granger led Union soldiers into Galveston, Texas, to bring news that the Civil War had ended, and to read General Order Number 3, which stated that in accordance with President Abraham Lincoln's Emancipation Proclamation, all enslaved African American people were free and entitled to absolute equality of personal and property rights. And whereas, following the statement, which unjustly, unconscionably came 2.5 years after the Emancipation Proclamation, leaving African Americans enslaved even though President Lincoln had freed them, June 19th became the emancipation date of enslaved African Americans who had long suffered and fought for freedom, justice, and equality. And whereas throughout America, Juneteenth celebrations are convened on June 19th to celebrate African American history, journey, and culture. And whereas Juneteenth commemorates the strength and courage of African Americans, the contributions of African Americans to the building of American institutions, wealth, innovations, and their ultimate triumph over extreme adversity through sheer determination and overwhelming tenacity. And whereas Kentuckians must continue to work toward a more equitable and just Commonwealth while recognizing the horrors of slavery and its legacy. And whereas recognition of Juneteenth reflects the Commonwealth's resounding belief in liberty and equality for every citizen. Now, therefore, I, Andy Beshear, Governor of the Commonwealth of Kentucky, do hereby proclaim June 19, 2020 as Juneteenth National Freedom Day in the Commonwealth of Kentucky.
I also wanted to provide an update about something I was able to do before COVID hit. It happened on my third day in office. It was an attempt not just to do the right thing, but to correct an injustice, which has been the chronic disenfranchisement of so many people in Kentucky, but especially our African American population. And that was when I signed an executive order restoring voting rights to all felons that had committed nonviolent, non-sexual crimes and had completed their sentences. It would happen automatically. At that time, we estimated that about 80,000 people got their voting rights back right then. It was a moment where just the stroke of a pen could restore some dignity and give people a voice back, not just in public, but at that ballot box. And I remember two individuals who were getting their rights restored, both being there, one with his twin daughters who'd never been able to see him go and cast a ballot. And he had lost his rights when he was 18. He'd never been able to vote. I remember handing him one of the pens, and it's a moment that'll sit with me for a long time. It was one of the best days I've had doing this job. Well, as of today, because that executive order was automatic and restored rights every day that somebody completed their sentence, 175,053 ex-offenders have now had their right to vote restored. Now, each of these individuals still has to register, and even though registration deadline is passed for the primary, everybody can still register for the general, and we'd love to see 175,053 people registered. That's the number of people who've had rights restored. This was a priority of ours. It was the right thing to do. It was something driven by my faith and belief that people deserve second chances, that redemption is possible, and that by giving people not just the tools but the dignity to rebuild their lives, that better and better and better outcomes are possible as we move forward. Very excited that that number is now over double what it was the day we restored those rights. I want to do a quick update on the Team Kentucky Fund. It's been run by the Lieutenant Governor that is out there helping those in need. Give a brief update on number of people helped and dollars that have gone out.
Thank you, Governor. So as of today, the number of households that have been helped by the Team Kentucky Fund are 421. And the total value of the vouchers and of the dollars that have gone to those households is $350,215. There are currently 398 applications that are pending for approval, which means that they are just waiting on additional documentation. I want to remind folks that the web address that they can go to apply to be eligible for Team Kentucky funds is capky.org, and that is the Community Action Partnerships of Kentucky's website. And the reason that we are partnering with them, it goes beyond the Team Kentucky Fund, because as an applicant, when you apply for the Team Kentucky Fund, you can have access to our funds if you qualify, but you also now have access to all of the services provided by Community Action, which helps with job placement, affordable housing, health care, child care, education, and job training. And so there are a litany of other resources that are accessible through this application. And so I would recommend for all Kentuckians who are in need of assistance to apply and take advantage of all of the resources from Community Action of Kentucky, as well as the resources from the Team Kentucky Fund. Thank you.
All right, quick announcement on federal financial aid. COVID-19 has forced us to an inflection point in our economy, and I believe we must think strategically about what we want our recovery to look like. Now is the time to train and prepare our workforce for the years ahead. That's why I'm urging all graduating high school seniors, parents, and adult learners across Kentucky to complete the free application for federal student aid known as the FAFSA, F-A-F-S-A form. Kentucky's overall FAFSA numbers are down 2.7% from this time last year. And for returning Pell-eligible students with the greatest financial need, the percentage decrease is 3.8%. We can do better in Kentucky. These are dollars to help break, oftentimes, generational cycles of poverty that are still there, that are still on the table, and that we want to make sure that people take advantage of. Filling out one of these forms is a free process that most applicants can complete in under a half an hour. It is a crucial step in preparing for college and can help provide certainty to many of our Kentucky families. Each year, the U.S. Department of Education provides more than $120 billion in federal grants, loans, and work-study funds to students, and we want Kentuckians to capture as much of that money as possible. All right, finally, before we open it up for questions, I want to go over a couple things related to unemployment. First, yesterday there were some folks, 67 of them exactly, that stood in line for, I think, about 10 hours in the sun. And then right as it was their time to be helped, they were told that at 7 o'clock our system shuts down, and that's to send payments through to get them processed to go to the federal government. But what an awful feeling that must have been. My request last night, and I've been checking on it throughout all morning, is that every single one of these people needed to be contacted today. I wanted it done before noon, and that they needed to have priority of getting helped. So I am told that as of, and this was 3:15, 61 of the 67 have had their claims resolved. Now, that doesn't mean necessarily that they were approved, though I think most of them were approved, but that their claims were fully resolved, and 6 are in process. I can't imagine what that must have felt like. We're going to get those claims done. Separately, I was asked the other day, why aren't we out in offices around the state? And my response was COVID. It's a worldwide health pandemic that has prevented a lot of face-to-face. But the history behind where unemployment is now and what we had to work with when this hit is a little more complicated than that, because there used to be a lot more unemployment offices. So a lot happened in 2017 that we are feeling the brunt of today. And basically what it says is when you develop a system, this wasn't just in one administration, but when you develop a system that's meant to tell people no, when you need to tell people yes, it is much more difficult. And when you make deep cuts in areas that are supposed to be there to help people at their lowest point, well, you have fewer people to help your population when they're at your lowest point. I remember this from 2017 when it was announced. When 29 unemployment offices were cut, we used to have 51 all over the Commonwealth. They were reduced down to 21. At that point, 95 employees who worked in unemployment, who were there to help people, who were trained in getting these claims through, were sent to other parts of state government, meaning a loss of critical personnel. I believe at that time, face-to-face interactions were removed, and what they had as of 2017 was 12 people who would answer the phone in a call center. Put on top of that, the software that's still being used that we hope to upgrade went in 2000. That's the year I graduated from college. 20 years old, and had never been fully funded in an upgrade in a budget. I believe they created a fund to start some of those dollars around 2018. Then the budget. The budget cut almost in half over time, $41 million, and that's not dollars going out. That's the office itself in 2010 to just $25 million in 2018. So we take offices that were cut almost 50%, an antiquated system that was designed to tell people no, and claims that went in 2019, 190,000 unemployment claims all year long, to having 900,000 claims in just 3 months. And it is a perfect storm that results in so many people who have had to wait far, far too long, that haven't been helped, and I know are at their wits' end. And I've been saying it for weeks, and I know it's not a solace to those that are struggling. We are working our hardest, and we will continue to do better. Despite all this, and I think I'm just starting my first budget that at least is one that we proposed, though not necessarily what we got in July, this is still my administration. These are still our folks, and we've got to get this done, and we've got to get it fixed. Today, we had, I think, one of the largest number of adjudicators, certainly working in one location that we have had. They are going to do the same in the same location tomorrow. Our hope is that while it won't be next week, but potentially the week after, that we can have people back in areas around the state able to help them so that people don't have to travel. But they haven't been in those offices, with the exception of 12 folks we sent back out there in February, since 2017. So we're not just having to restart, we're having to rebuild. But we've got to do it really fast. So we have some meetings set up tomorrow. I know with some outside folks that are going to give their thoughts on what type of assistance they can provide. I will take help from anywhere if it gets people's claims processed and paid. This is our commitment moving forward, and it's something that we absolutely have to get done. I do want to put it in context that it's not just people in Kentucky that are suffering. They're suffering all over the United States. In Michigan, they have 340,000 claims outstanding. In Tennessee, they have 309,000, what they call active claims. Maryland's about 71,000. As opposed to our rate that we've gotten through of claims that have been filed, which is right at about 90%. Pennsylvania is at 85%, and Virginia is at 75%. And all around the country, you see the same challenge. I mean, all around the country on the past however many years, we designed an unemployment system that wasn't supposed to help people, that was supposed to keep them from getting what they desperately needed. And this is what happens. You know, now we see, and it's good to see, people from all parties saying, why isn't unemployment easier? Why can't people get the help that they need? I hope we see the same bipartisan commitment going forward. I hope we see the same type of buy-in that the safety net isn't something that people are out there abusing. It's something that's necessary in a time of crisis. And I hope that we will never starve these systems again, that we will maintain and improve what we have, and that we realize that everybody needs a little bit of help sometimes. And once in every 100 years, or more frequently, a whole lot of us need help really fast. All right, with that, we'll open it up to questions. We've got a number of folks today. We've got Joe Sonka, Dia Davidson, Joe Ragusa, Phil Pendleton, who's back there, and Daniel DeRocher. And I don't think I missed anybody, did I? All right, Joe.
In regards to Juneteenth, what exactly is the state going to be doing, or your office, or you specifically going to be doing to kind of honor that date tomorrow outside of the proclamation?
Well, today is the first proclamation, I believe, that's ever been signed for Juneteenth, or certainly the first publicly. We're going to continue to work on our efforts to address historic inequities, including our pledge on health care, where we were going to sign everybody up in Kentucky while I'm governor for some form of coverage that they qualify for. But we're prioritizing our Black and African American communities because not just historic inequalities, but COVID is killing them at twice the rate they make up of our population. There's some other events that are going on that we hope that we have many people in the administration participating in, and we're going to start our efforts to get it addressed as a state holiday. We hope this time next year will be one of our official state holidays. Dia?
Governor, good afternoon. Unemployment, of course, continues to plague our state. Up in the ranking of our state at 47th worst in the nation when it comes to recovering unemployment claims. That came out today. The statewide issues with long lines featured on Today's Show this morning. And I have been fielding UI questions since March on our LEX18 Facebook page and our designated email. People are frustrated. People are hungry. People are losing their homes, their cars. To say that they're going to do something sometime is not good enough for them. They're saying that their CARES money that they should be getting, they aren't getting. And that's about to expire July 31st. People need a definitive answer, not just saying that you're trying. And they appreciate that you're trying. But they can't take that to their landlord, and they can't take that to the grocery store. What can you offer to our fellow Kentuckians with a definitive?
Well, what we can offer to our fellow Kentuckians is that we have more resources going towards addressing their claims than we have in at least the past 8 years. I can't talk to what was available during the Great Recession because I know that there were federal dollars that flowed into it. We have more folks on site here for the very first in-person help, and understand that COVID has made this difficult in two ways. Number one, causing widespread unemployment, and number two, making it very dangerous for a period of time to be face-to-face. And what we've learned is face-to-face is really important. It's really, really important. We're seeing more claims resolved in the last several days, and today, people getting very definitive answers before they leave. We're going to make sure that here, moving out, that there are more face-to-face opportunities in every single community so that you don't have to drive. But I also want to be transparent with people. Our system isn't going to change overnight, that 20-year-old system. And it takes time to train people, though we were doing it today. If you notice, we had a person helping and a person being trained so that we can have more Tier 2 and Tier 3 folks to help. It's going to be a process to come out of it. I wish I could tell people it's going to happen tomorrow, but with the number of claims and where we are in a starved system, I wouldn't be that wouldn't be being honest with them. My hope is that with some outside help, we can certainly speed up this process. But we are seeing, I believe, improvements as we go, and they need to be improvements that last, that are permanent. If we help somebody get their first check, but their next one gets held up, that's not good enough, and it doubles your work. And so while I keep telling people that we're going to keep hustling, we're going to keep trying, part of it is hustling through the number of claims, but we're going to take what we've learned on the last 3 days and put it to work and continue to do better. Now, nobody should be evicted because we have a ban on evictions here in Kentucky. But I hear all the problems, I hear all the concerns, and I know people are frustrated. And while I can't feel that frustration, I'm frustrated. I'm frustrated with our system. I'm frustrated with the amount of time it's taking for claims to happen. I'm frustrated that the numbers seem to change from day to day. My frustration isn't going to solve it, but hopefully my motivation and my willingness to spend at this point whatever it takes to fix it will help fix it. Yesterday, Karen Czar asked for the number of people who were working to process claims. Today, Lieutenant Governor, how many do we have in the facility today? We had 29 individuals. I said it was 30 yesterday. We went over 61 of the 67. The report had been 20 to 25. We had 67 names. So 61 of 67 have had their claims resolved. The other 6 were in process. There was someone assigned to them, and I'm told there was at least one phone call that was made. But the reason that it happened is the system, up until today, automatically shut down at 7 p.m. every night because you got to send those claims to the federal government and you got to process the first set of payment. We're going to be able to go longer today, but people wouldn't get paid if the system doesn't do it overnight. But it still wasn't right. It doesn't seem right. And those people we've got to help. Last question here is, what's my reaction to today's Supreme Court DACA ruling and how it impacts Kentucky streamers? I think it is a decision that was made not just under the law, but with people's heart and with people's faith. These are individuals that have never known another country. Listen, they're Americans. This is the only country that they have known. I believe they're just as American as any of the rest of us. And I think it was the right decision. Other Joe.
The organizers of Fancy Farm announced today that they're going to continue having their event this summer, but instead of the shelter outdoors, they're going to move it inside. Do you think that was a responsible decision, and do you plan on going?
I haven't seen the plans for Fancy Farm. I just saw an alert about it. I'd have questions about the number of people that are going to be allowed inside, and also what their other setups are going to be. I'll only go if I believe that it's not only safe, but it is a safe example for the public on how to do things. I've been trying as best I can to follow the advice that I'm giving to people. For me, it won't be a political decision this year. It'll be entirely COVID related. I've been to more Fancy Farms now on the last several years, not having missed one in a while. But I want to make sure that it is a truly responsible approach that they're doing. And for that, I'd like to see their plans. Daniel?
First question is, are you going to be doing this in-person unemployment next week past Friday?
So we don't have an announcement about the in-person Frankfort unemployment for next week at the moment. One thing we want to make sure we do is everybody who drove up in the last couple days that left their names, they need to be helped. And so the first several days of next week, our plan is to put all of our adjudicators on those and anybody else who may have waited and wasn't helped during that period. We want to make sure, because you look back on the number of employees, now we have more than 12 now that can do it, but we still have limitations. And we're working to lessen those limitations. So that's where we want to help first. Our goal is, it might not be next week, but certainly the start right after that of having people either out in the state or this group traveling. Because by now we've helped a lot of people in Frankfort who have driven to Frankfort. We got to make it easier on people too who cannot get away from their community. So we ought to have an announcement on that, hopefully end of tomorrow, at worst on Monday. But Monday, Tuesday at least, we've got to help the people that drove up. We're told that they couldn't get in line because they would have waited all that period of time. They've got to be helped. Would new guidelines from the state be potentially in place by August 1 as a part of reopening phases, allowing groups of more than 50 to gather? That's possible right now. We're looking at moving to the 50 and under, and I will tell you, aside from different groups that are submitting individual plans that we believe have a good plan in place, we're going to have to be really careful when we hit the 50 and under and when we hit 50% capacity in most places. With what we're seeing going on around the rest of the country, that's a time to just look really carefully about where we are and if it's still under control and manageable to take that next step. But we're seeing spikes in a lot of different places. And the White House's advice, Dr. Birx specifically, is that our future probably looks at 50% of our contacts being a manageable range until there is a vaccine. And I'm taking that advice directly from the doctor chosen by President Trump and Vice President Pence very seriously. Phil.
If you could go back and change anything about how the unemployment situation has been
Yeah.
handled, would you change anything?
If I could change how our unemployment situation has been handled, we would have found some way and some dollars, even though I have no idea where, given our budget hasn't started, to update that system. We would have done it. When was I inaugurated? December the 10th? I don't know. It seems like a long time ago at this point. We would have done it the next day. And we got to look at our other systems across state government. We can't allow this to happen anywhere else that people need, because it's still causing problems. So we had a system that was designed to tell you no. It was designed to tell you no. No if you're an independent contractor. No if you're a substitute teacher at a church. No if you've checked the wrong box. Just no. And hoping you wouldn't come back. My belief is a lot of our law was structured that way. The second thing I would have done is move people out a little bit earlier, though we did February, to the centers. And then the question is, what would we have done differently with COVID, given how it was spreading and when it was spreading? And that's been a significant and major challenge. But I'm willing, when this is over, when we help everybody, to look back and be completely open and transparent about how a future administration can make sure it never happens again. I know it hurts people that need and haven't gotten their benefits a lot more than it may hurt me, but I want them to know that it does hurt. I ran on helping people. And we're having a real hard time getting everybody the help they need right now. Let me do one here. Several counties in West Virginia are reporting cases of COVID-19 that are related to travel to Myrtle Beach, which is a popular vacation spot for people in Kentucky, too. What concerns do we have? There are a lot of concerns right now about travel. And there's a lot of articles about Florida maybe being the next epicenter. An outbreak, they say, potentially could be worse than New York. We'll see. We had a prison that was overrun with COVID, we think initially because of a trip to Florida that then folks came back from. I know there are a lot of people that really want to go on vacation in other places. I just urge you to be really, really careful. In Kentucky, we have numbers that seem manageable. We know where we can get you in a hospital bed. I can't say the same necessarily for other states. Joe.
I know you kind of addressed this yesterday in regards to the lack of available kind of office space for unemployment help, but what's preventing the state from using other facilities or even county or local government facilities, anything really, in any of these other parts of the state, just have a temporary kind of setup?
Right, that's what we're looking at. It's about having the practices to do it safely in COVID, having the right facility to do it at, and then deploying them to do it. Should we have started face-to-face a little bit earlier? Possibly. It's hard to know in COVID when it would have been safe. Perhaps when we started opening some of the other areas that we've opened, or maybe when we first started reopening government. But yes, there are other locations out there, including our career development centers are still there. Now remember, they were cut down from 50 to 29, but there's still space in some of those other places. So we plan on taking advantage of wherever we can get, where it can be done safely. Now we do, from a logistics standpoint, want to make sure we do this right. Because if we've got 29 people over there, and we've got some at home, but let's say 29 people that are trained and we put them out at 29 different locations, how many people can you help a day and how long will the line be? So we want to be smart about doing it effectively. Right now that looks like moving a group around in different regions so that hopefully we can make a significant difference in specific days, while we still have some working virtually, some that fall in the danger zone of COVID that need to work virtually, and where we're continuing to work that side as well. Deal?
Governor, I just wanted to get a clarification and then ask a question. You said that the UI office would be open late today and tomorrow?
Well, we provided tickets to everyone. Our goal is to help everyone that has a ticket. My hope was that we would start working over the phone with people near the back of the line to try to whittle that down as we go. But I know that we've got an authorization to stay open. How much later? Right now it looks like until 8, but I don't want what happened last night to happen tonight. And while people from yesterday are getting help, they had to go through a moment that you shouldn't have to go through, on top of everything else.
21 states with new spikes in COVID numbers, and that's climbing. Any thoughts on closing our borders, especially when we're looking and anticipating college students coming back from various states? And our flagship university is saying that they're going to open and they close at Thanksgiving.
Right now, we don't have any plans on closing our borders or reinstating a travel ban. One thing that's really important is the amount of compliance that we get, and not setting certain rules that people aren't ready for at this time. Admittedly, we've seen a drop-off on compliance of people following the rules and the best practices for COVID. And I know they're tired, and people may think they see other examples out there of folks not doing it. We are safer if we simply follow, whether it's the 10 rules for being healthy at work or healthy at home. And I'm telling you, everybody in the public health field right now is saying the key is wearing a mask. And you see countries where everybody's willing to wear a mask. It's their patriotic duty, and you see their cases plummet really fast.
Earlier today, Attorney General Daniel Cameron said he did not have a timetable on the conclusion of the investigation for the fatal shooting of Breonna Taylor. When do you want to see some definitive answers and to any investigations, whether they be at the state, city, or federal level, as to what happened?
I think people out there are waiting for an evaluation by Attorney General Cameron, and I think that, and I hope that he feels the importance of getting it done soon. I haven't seen the file. I don't know its size. He had the opportunity to appoint a special prosecutor that could otherwise be working on it, and he kept it internally there for their office. So the timing is really dependent on them and the amount of time you put in. And my hope is that it's soon. I think that this one of the sources of frustration is how long it's taken, how long. And I would say the same for federal authorities if they also have an investigation. I think people want answers. They want the truth, and they just want people to be honest and transparent with them. Let's see. I am checking to see if we received a Churchill Downs proposal for the Kentucky Derby. We have received it. It's being reviewed by Public Health. I know we have made some comments back on it and are waiting to receive feedback. All right, here's one, Secretary Freelander. One of my early executive orders allowed people who are unemployed to be on Medicaid through July 31st. Is that going to be extended? We'll make sure we get the right answer. Yeah.
We are reaching out to all those individuals who've had applied for and received presumptive eligibility to get them on Medicaid, in regular Medicaid. At this point, there are 6 individuals we're worried about, and we're working on them right now.
Banks are beginning to reopen their lobbies. What are the type of guidance or order to allow them to reopen? We would strongly suggest that they follow as much as possible the retail and other guidance, having people come in and around those same types of guidance should help make it safer. And then within their office portion, I know this question is about lobbies, following the office openings. Phil?
The large number of people that have been waiting in line for unemployment, are there any concerns about the fact that you've got some people wearing masks, not a lot of social distancing happening there?
Yeah.
Just any thoughts about that?
Yeah, there are concerns. And it's in all of these balancing, getting people the help they need. versus the fears of COVID. And that's been a concern that has driven the model that we have used up until now. I believe that we had 2,000 masks available yesterday and today for anybody who didn't have one, and they certainly get them before they go inside, which would be the area that would be the most dangerous based on what we know. It's in many ways like the reopening, and I know it seems it is dramatic given the size of the lines, and it creates a visual that people would say, at least on the politics side, I shouldn't want. But if it gets people help, then we'll do it. Now, I don't want people to have to wait that long in line, but if it gets people the help that they need, if it makes me look bad, I'm not worried about that. I want to get this thing done. I want to get it fixed. I want to get people help. I want to get their claims resolved. And it's frustrating. It's taking so long. I know it's more frustrating to those individuals.
How many Tier 3 employees are there actually, and what number would you like to see get?
Jacqueline, how many Tier 3 employees do we have? I was asking.
No,
Total. And let us get you that specific number. I was actually trying to pull the total numbers today. So I know it's above 29 because we still have some working remotely, though I will tell you our Tier 3 folks were excited to come in and to work, and they want to address this too. Right now, we need as many as it takes. And when I mentioned I want to look at all options, including outside help, we've got a huge group that need help right now. And then it's got to be significantly more going forward. And we've got to get it back regionally. So if I was looking at what I want in an employment system going forward, it's got to be a new database based on new rules that isn't designed to tell people no and can tell them when there is an error that they might have made and how to correct it without having to call a hotline. In other words, if you check a box that would kick you off, but it doesn't read like it should kick you off, that's how the system's designed, to tell you no. Then it ought to tell you as you're checking that box, whether it's in red as you're looking at it, that this would prevent eligibility, and here are questions to be asked about it. I mean, in our world of technology, we'd be able to resolve a lot of claims that way. We need to have Tier 3 folks throughout the state. We'd like to see them at our career development centers. I think we ought to get back to the 50. I remember when the move was made to go down to 29. I think it was in Harlan and different places in eastern Kentucky. I think they just looked at a map and said, well, there's one here for this area, and they hadn't looked at how long it would take to drive. Now, obviously it takes less time to drive there than it does to Frankfort. But we got to get them out in those communities, and we got to have significantly more. And it needs to be based on knowing that, at least for the short term, while we won't have the unemployment rate we had right now, it fell significantly last month compared to the month before. It is going to be higher until we get our state fully back on track and back to full strength. But in the end, what do I want it to do? I want it to be able to help people, help them fast. I don't want them to have to wait weeks. I don't want them to have to wait months, but they shouldn't have to wait weeks. I want them to be able to get their questions answered when they have them, to not call and not get through to anyone. And when you look at the numbers of calls versus the returns, I mean, it's a tiny fraction. I do believe that the in-person, as long as we can do it safely with COVID, now moving forward is resolving it faster, and it's a more satisfying experience. And I think that when folks are able to be helped, they know it's not the fault of that employee. Maybe the fault of the system, maybe the fault of the governor, but it's not the fault of that employee, and that they're working hard to help them out. But we, on all of these programs, on all of them, on Medicaid, on SNAP benefits, we spent decades, or at least the last decade, designing laws and regulations and systems to tell people no, and we're seeing what that creates. Now, my job is to fix it now and to create a system going forward that when people qualify, they won't be arbitrarily told that they don't. All right, we've kept it a little bit under an hour. I do have that birthday party to get to. We will be back here on Monday. We will continue to work hard every single day in every area we're facing. What I'd ask people on COVID is to be safe, Jobs are bouncing back. The rate from the previous month to last month was better than we expected. Our dollars flowing into state government are better than expected. If we can keep that up, we can bounce back faster. And if we do this right, we don't end up in a situation like a couple of states right now appear to be looking at, where we would have to consider pausing. We can build things back up much more quickly if we care about each other, if we follow the rules, and we continue to do the right thing. Thank you all very much.